since I have become a nurse, since that time, I have questioned being a nurse for 14 years and truly why I'm in this profession a lot of the times. Because unfortunately, yes, I started my career out. I worked in addiction. So I worked in a methadone clinic. I worked in, like you said, a men's and women's residential. I worked in a lot of different areas within the Addictions Foundation. I never got a permanent position though. So I ended up kind of going into home care in Winnipeg before I came to Calgary. And so I kind of like dipped my toe in there and it was okay. I was in the hospital, psychiatric hospital, not bedside, ER nursing, psych hospital. But honestly, I was doing day and nights and I almost committed myself after 3 months. Like I was like, I'm done. I can't, like, I need help. Can you take me on as a patient? No. So I knew that just wasn't my thing. I'm not good at nights. Like just with the way I am, I just am not good at it. I tried to get into addictions out here, but I started in detox. It's not my shtick either, but it was addictions. And then I kind of went into home care. I went into transition services. I went into case management on all different teams, and I stayed in that for a decade. Yeah. And I burned out of it. I was bullied. I was bullied by the nurses on the team on one team. Then I was bullied by management on another team. The journey that I've had thus far as being a nurse has been hell. And trying to build my confidence in this profession has been nothing short of challenging.
It does feel painful to hear when you say that your journey has felt like hell. That's a tough experience to have gone through, something where your entire mindset was, I'm going to go and conquer the world and I'm going to do this for patients and I'm going to be this like amazing ER nurse. And then, of course, to the other fields that you decided that you were going to walk in. But it feels like a disservice to the profession when even one nurse can say that they've been bullied or there has been incivility or toxic workplaces that they've been exposed to. And so I think that there is a lot of fight now for change. There are some pioneers now who are doing great work. Teresa Sanderson, Kathleen Bartholomew, really fighting for that nurses feeding their young image versus the nurses eating their young, which has kind of always been the narrative. Sorry that you've gone through that, and I'm really glad that you're creating something to bring about that change and to create community among nurses.